Hello and welcome to this informational site. My name is David Rain, and today I will be discussing the Affordable Care Act and its impact on asthma patients as a group. I will be discussing asthma management, triggers, and symptoms, the Affordable Care Act and its Title IV, which cover chronic diseases and preventative services, how asthma patients were taken care of before the Affordable Care Act was implemented, some changes made due to the Affordable Care Act, how new insurance plans will support asthma patients, health homes and their ability to help mend the fragmented healthcare coordination system that is currently in place in the United States today, some advantages and disadvantages of the Affordable Care Act. The World Health Organization defines asthma as a chronic disease characterized by recurrent attacks of breathlessness and wheezing. These attacks vary in severity and frequency from person to person. During an asthma attack, the lining of the bronchial tube swells, causing the airways to narrow and reducing the flow of air into and out of the lungs. The Centers for Disease Control and Prevention state there is currently no cure for asthma, and it falls under the category of chronic conditions, as does cancer, diabetes, and heart-related diseases. These diseases share a common trait in that they can be very expensive on both patients and their families and the healthcare system. Asthma costs in the United States total $56 billion each year. Some more statistics are that 1 in 11 children have asthma. This accounted for 7 million children in 2010. Asthma also accounted for 18.7 million adults in 2010, which is 1 in 12 adults. A patient with asthma can have symptoms that cause them not to be able to attend school or work. This can result in inefficiencies in productivity from these patients, which in turn can affect businesses and the economy in the United States. The Centers for Disease Control and Prevention also state that roughly 9 people die from asthma each day. Asthma is prevalent among children, adults, both sexes, and every race and ethnicity. In children, it's prevalent 8.3% of the time, while adults is prevalent 7.0% of the time. Females show asthmatic symptoms more than males at 8.3% compared to 6.2%. African American patients have a prevalence of 9.9% compared to white patients at 7.4% and Hispanic patients at 5.9%, according to the Centers for Disease Control and Prevention. Some symptoms of asthma include shortness of breath, chest tightness or pain, trouble sleeping, whistling or wheezing when exhaling, and coughing or wheezing attacks, known as asthma attacks. All of these symptoms make everyday life more challenging for these patients, and managing these conditions are essential. Asthma attacks can be caused by several triggers that are unique to each patient. The exact cause of asthma is unknown, but triggers are well documented and include allergens, exercise activities, occupational hazards, tobacco smoke, air pollution, which can be attributed to where a patient resides, as well as airway infections. Asthma management can be very difficult, and there are two types of relief methods, which are short-term and long-term. Long-term methods are designed to reduce the severity and volume of asthma attacks, but they're not as helpful during an asthma attack. Short-term relief methods, on the other hand, help control asthma attacks during their onset, but are not best suited for long-term relief methods. In certain cases, patients become more and more reliant on their short-term relief methods rather than long-term relief methods. In order to avoid this, triggers must be identified and avoided by working with your physician to develop a plan on how to effectively manage asthmatic disease. The Affordable Care Act has many promising features to patients with chronic diseases. This is great for asthma patients, as the Affordable Care Act was designed to improve quality of healthcare and reduce costs. It was implemented in 2010 by President Barack Obama. It created a health insurance marketplace and extended the age of coverage to 26 years of age for children under their parents' insurance. It also eliminated pre-existing conditions as a reason for denial of insurance coverage. Obamacare, as it is commonly referred to, was enacted to help solve the crisis of healthcare spending in America. Healthcare spending in America accounts for $2.6 trillion annually, while the U.S. ranks only 50th in life expectancy, with 50 million Americans uninsured. However, since the Affordable Care Act, 105 million Americans no longer have lifetime limits on insurance. 3.1 million young adults have stayed on their parents' insurance plan until age 26. 30 million Americans are expected to gain insurance coverage. 86 million Americans have obtained a free preventive service, and 17 million Americans with pre-existing conditions will have access to insurance. And this is all from 2012, meaning that the benefits may exceed what they were stated at the time. Title IV of the Affordable Care Act is titled Prevention of Chronic Disease and Improving Public Health. This title specifically applies to asthma patients and other chronic diseases. This title promotes prevention, wellness, and public health through funding these areas. It creates national prevention and health promotion strategies to reduce preventable illnesses and disabilities, such as asthma. It also allows annual visits with primary care physicians as a means of enabling early detection. Asthma patients, before the Affordable Care Act was implemented, could be denied coverage from insurance companies due to pre-existing conditions. This is due to the high amount of spending that comes with managing asthma patients. This spending would place a huge burden on the insurance company, so they would view asthma patients as high-risk patients. It would also be very costly on patients and their families, since they could not access insurance coverage and would have to pay for their services out of pocket. Preventative services were not covered before the Affordable Care Act was implemented, so it was, with it being very difficult to ascertain the presence of asthma in children under the age of 5, this did not help. The fragmented system made management more difficult for patients, as there was not a great coordination of care that existed before the Affordable Care Act. Some changes that were made due to the Affordable Care Act were that now pre-existing conditions were eliminated as a reason for denial of insurance coverage. Preventative services were also included in insurance, which aids in early detection and better management of chronic diseases. Children are now covered until the age of 26 under their parents' insurance, which greatly helps young adults who have asthmatic conditions as they have coverage. The health insurance marketplace established helped increase transparency among patients and insurance companies, as they could view various benefits, and it also increased the level of competition between insurance companies, since it was now a marketplace where patients could view various features of each insurance. Insurance companies under the Affordable Care Act after the implementation of the Affordable Care Act, can no longer cancel your coverage for application mistakes. Lifetime limits have also been banned from insurance plans, meaning there's now no cap for services covered. This greatly helps asthmatic patients since they have a chronic disease that needs to constantly be maintained through treatment. Insurance companies must justify rate spikes publicly now after the Affordable Care Act was implemented. And patients now have the ability to seek emergency services outside of their network without being penalized by higher payments. This is great for asthma patients because it saves them a lot of money if they have to seek emergency services due to an asthmatic attack, but they're not near a facility that is covered in their network. New insurance plans will help support asthma patients through health homes that are provided by Medicaid services as an option. It would also be helped by the preventive care and health marketplace options that I talked about before. The patient-centered medical home is a Medicaid service model and allows people with chronic illnesses such as asthma to select a health home. This health home helps increase the coordination for their care. In a health home, healthcare revolves around the patient. It can consist of either an individual provider or a team of health professionals that are selected by the patient. These health professionals are responsible for all patient healthcare services. Since each member of this healthcare team or the individual being selected has the consistent aim of taking care of this specific patient, they all become familiar with this patient and their disease, their asthmatic disease and conditions. So it's an increase in the level of coordination since they can become more familiar with the triggers associated with this specific case. Some advantages that are seen with the Affordable Care Act are, to summarize, the patient-centered medical homes make management easier for the patients and for providers. Preventative services can help detect asthma early in patients before it becomes more severe, and this can help as well in limiting the amount of patients being rushed into emergency rooms. Patients can no longer be denied insurance based on pre-existing conditions or sickness such as asthma. Health homes, though they are currently an option provided by Medicaid, they have the ability to be extremely beneficial for extreme cases of asthma that require intensive management, as well as pediatric asthma, where it can be very hard to determine when a child develops asthma. Some disadvantages of the Affordable Care Act are that some patients have to leave their provider if they fall outside of the network. Some patients will also face fines if they do not purchase health insurance, since it is now mandated. Another disadvantage is that the cost of medication is still high, and not all medications are covered under all insurance packages, which is why the healthcare marketplace is designed with an effort to help increase the health literacy of patients in the United States. It is important for these patients to learn the most they can about their illness when seeking out these insurance packages. In order to do this, through doing this, they can find the package that best suits their specific needs, since each asthma case is unique to that patient. In summary, the Affordable Care Act provides some great benefits to the current state of the healthcare system in the United States. These benefits are seen by patients with chronic conditions such as asthma patients. Since these asthma patients fall under the chronic illness group, the benefits received by this legislation are immense, and only time will tell whether or not the Affordable Care Act will solve the healthcare crisis that has been instilled upon us. At this point, I would like to conclude my presentation and thank you for watching. Have a nice day.